question carefully, guys. That is so important. Again, what is the reference method for glucose measurement? Hexokinase. Most specific method for measurement of beta-D glucose oxidase. But general question, most specific method for measurement of glucose in whatever sample? Hexokinase. Most specific reagent? G6PD. That is important. And how about glucose dehydrogenase method? Guys, saan daw kino-compare? Hindi naman kino-compare, ina-associate si glucose dehydrogenase, not compare but associate. It provides results in close agreement with the reference method. It provides results in close agreement with reference method. What is the reference method? Hexokinase. GDH is glucose dehydrogenase. That's GDH, glucose dehydrogenase. Ma'am, halimbawa tanungin kami sa board exam, what method can be used as alternate for hexokinase? Glucose dehydrogenase, because it has close agreement with hexokinase procedure. And take note of this, people. This is also considered an accurate method for measurement of glucose. IDGCMS. The IDGCMS is also considered as an accurate method for measurement of glucose. The IDGCMS. What else, children? Oops. We have dextrose. It is a cellular strip impregnated with, oh guys, eto ha, para klarado ha. Etong strip, ang tawag po sa strip na yan, etong strip na yan, dextrose. This gadget, this portable glucometer. Kasi akala nila ang glucometer yung strip. That is the instrument for measurement. The strip is dextrose. Next question. What is the reagent or method embedded in that strip? Is it glucose dehydrogenase? Is it glucose oxidase? Or is it hexokinase? Uulitin ko, guys, ha. What is the method embedded in that glucose strip? In that dextrose strip? What is that method? Glucose oxidase, hexokinase, or is it the glucose dehydrogenase? What is our answer? Kung board exam ngayon, Hyacinth and De La Cruz. Excellent. Ang answer ni Hyacinth De La Cruz, no? Yan yung commonly used. What is that? Glucose oxidase. And also, Judith Bautista and Christine Kylie Briñas. Excellent. The glucose oxidase method. That is the first dextrose, the glucose oxidase method. Huwag po natin kakalimutan. Ma'am, meron po ako nabasa na dextrose na hexokinase. That is the second. Meron na rin tayong dextrose hexokinase. Kaya lang po ang most common, si glucose oxidase. Yan talaga, guys. Ma'am, why is it that they created also hexokinase strip? Because that is the reference method. And children, how do you call those tests in chemistry? Generally speaking, how do you call those chemistry tests that can be performed by patients themselves? Can be performed by non-laboratorian personnel. Take note that can be performed by the patient themselves and non-laboratory personnel. Excellent, Katrina Carlos and Bacayana were the first to answer POCT, point of care test. That's why dextrose is for point of care test. It is used for establishing correct insulin amount for next dose. Yung mga pasyente po natin na may confirmed DM, they are advised to measure their sugar a month, no? Parang titinan na makikita ng doctor, tapos nire-record yun, tapos pinapadala yung sa doctor, pipicturean mismo yung glucometer, pipicturean, papadala kay doctor. Minomol. Why? Because they would like to know if they need to increase the insulin dose or they don't need insulin already, so they have to send the actual photo of the glucometer reading. Mayroong rule po. If the capillary glucose concentration reached 140 and greater, 140 and greater, capillary glucose yan guys ha. Ma'am, is it fasting or non-fasting? Well, lalo na pag fasting. If the fasting capillary glucose is 140 and above, ano sabi ng doctor? Nako, you should be rescreened. No? You should be rescreened. Meaning, you have to have another sample testing, but this time we use venous. Ma'am, paano po halimbawa yung random blood glucose after eating blood glucose is 140? Do we need to report it? We can also report that if it is 140, so that doctors can tell us what is the next step that should be done. But ang capillary fasting glucose mo 140 and above, kailangan venous sample ulitin. FBS or HbA1c or OGTT. And take note, among these three tests, the first that should be prioritized should be FBS. If the capillary blood glucose is 140 and above, especially if it is fasting blood glucose, it should be FBS venous sample. Should be prioritized. Interstitial glucose measuring device, okay, copy this later or you can take a photo. This is a continuous monitoring of glucose levels in persons with DM using guys the interstitial glucose measuring device. It utilizes electrochemical process to automatically measure glucose in the fluid of dermis or subcutaneous fat tissue. Ma'am, we can measure glucose in the subcutaneous fat tissue. Correct. Ang tawag natin doon, interstitial glucose measuring device. Take note. Even the dermal fluid, take note. This glucose trend analysis can reveal useful findings for modifying treatment, such as unsuspected nocturnal hypoglycemia or postprandial hyperglycemia. Ma'am, the interstitial glucose measuring device is good for nocturnal hypoglycemia or postprandial hyperglycemia. Check. Take note of this line. Huwag kalilimutan yan. That's important. What else? And that is the interstitial glucose monitoring device. And this is the CGM data sensor and transmitter. CGM data receiver and display with insulin delivery system. Ay, ididikit mo lang siya, ma'am. Kaya pala fat tissue. You know the glucose level. Remember, guys, that the excess glucose is also stored in fat depot or adipose tissues, the excess glucose. So nakalagay dito guys a tiny continuous glucose monitoring sensor, ito yun guys, sensor under the skin checks glucose and a transmitter sends it here. This is the receiver. The transmitter sends it here, the actual reading. Nocturnal hypoglycemia and postprandial hyperglycemia. This device for glucose measurement is only supplemental, may supplement but cannot replace conventional home blood glucose monitoring. Ay, ibig mo sabihin, ma'am, mas best pa rin si glucometer. Check. Kasi blood talaga yon. Mas best pa rin si glucometer, ma'am. Yes, best pa rin. Together with the dextrose, best pa rin compared to this interstitial glucose monitoring device. You can buy, but you cannot replace the glucometer. Then what are the different samples for measurements of glucose? Different samples for measurements of glucose. You have your random blood sugar. Random blood sugar is for emergency cases. This is requested any time of the day. This is requested during hyperglycemic ketonic coma and insulin shock. Take note of that. Hyperglycemic ketonic coma and insulin shock. Eh, wala ng patient preparation. No? Talagang random blood sugar yon. And there is a rule, guys. If the RBS value reach 160 and above, 160 and above milligram per deciliter, what is the rule? There should be a follow-up test. So, ang tanong, ma'am, umabot po ang random blood sugar ng 160. Kailangan may follow-up test. Mom, greater than 160, kailangan may follow-up test. Is it fasting plasma glucose? Is it HbA1c? Or is it the 2-hour OGTT? Using 75 grams. Guys, kung hindi tayo nagkita ngayon, na tinanong sa'yo yan sa board exam. Question, what is your answer? Which of the three tests should be prioritized? Number one mo i-request if the RBS reach 160 or greater than 160. Kung ngayon ay board exam natin, what is your answer? That should be the first test that should be requested. The FBS, the HbA1c, or the 2-hour OGTT. What is the answer? Excellent, Judith Bautista. FBS. Okay, siya ang first na nag-answer. It should be FBS. Take note of that. Kasi that is the screening test for DM. The fasting blood sugar is a measure of glucose homeostasis. Take note. It is a measure of glucose homeostasis. What do you mean by homeostasis? The balance of glucose inside the body. And when do we achieve that balance? After 8 to 12-hour fasting. Remember, this is the only measure of glucose homeostasis, or the balance of glucose in the body. That is FBS. And how would we know there is balance of glucose inside the body? Well, the FBS should be what? 70 to 99 milligram per deciliter. That is the reference value for non-DM individual. Non-DM individual is 70 to 99 milligram per deciliter FBS. Remember, measure of glucose homeostasis. Ano pa? FBS is also a measure, guys, of a measure of the balance between insulin and glucagon. It is also a measure of homeostasis, or balance between the action of insulin and glucagon. Remember, guys, pag sinabi natin glucose homeostasis, balance between hormonal actions. Balance between hormonal actions, insulin and glucagon. So, pag-balance po ang action ng insulin at glucagon during fasting, 70 to 99 po ang FBS. That's why it is a measure of glucose homeostasis. 2-hour postprandial blood sugar test, it means blood should be drawn 2 hours exactly after eating a complete meal. Guys, kailan madalas i-request si 2-hour postprandial blood sugar test? Usually in the morning. You will instruct the patient, ma'am, ganito, pupunta kayo sa hospital. Then, once you reach the laboratory, you have to present this request. And the duty medical technologist the next morning will provide the instruction. Make sure, sabi sa patient, make sure, ma'am or sir, you don't eat anything before leaving the house. Sasabihin ni patient, can I drink water? Yes. Can I drink coffee? No. No beverages, no tea, no sugary, no candies, nothing, but you can drink water. Just enough, just 1 glass of water. Okay. Pagdating ni patient sa lab, ano sasabihin ng medical technologist on duty? Ma'am, this is 2-hour postprandial blood sugar test. 2-hour PPBS. Sabi ng patient. Okay. So sabi, ma'am, you have to take a full meal, full breakfast meal. And you have to mind the time. Ma'am, pag nag-start ka ng 7 a.m., that is the start of your meal. Natapos ka ng 7:30 a.m., you drink the water, you drink the coffee, sabi mo, I'm done, I'm finished. Sabi mo gano'n. Take the time. 7:30 po ako natapos. Then, the blood sample collection will be 9:30 a.m. Sabi ni patient, okay, tinanong mo, how many times sample collection po? Once. Tandaan, children, the 2-hour postprandial blood sugar test, how many times sample collection? Once. When? 2 hours after eating. 7 a.m. nag-start kumain. 7:30 a.m. natapos ang kanyang breakfast. When is the sample collection? 9:30 a.m. Tinanong ito kanina ng isang Zoom mate mo. Ma'am, si patient ba pwedeng uminom or kumain while waiting for the sample hour collection? Tell the patient, ma'am, after eating, you have to come back because I need to get the exact time you finish your meal. Bumalik si patient, ma'am, 7:30 a.m. po ako natapos. Tumingin ka sa watch na 8 a.m. Okay, so pwede pa. Ma'am, did you drink or eat something while walking, going to the laboratory? Ay, wala po. So after at exactly 7:30 a.m. when you drink the coffee and milk, or water. That's it. You did not take anything while walking from the Starbucks to the laboratory. Wala po. Check. You sit down, ma'am. We wait for 2 hours. Nagsabi ni patient, can I drink another glass of water? No more. Coffee or candies or anything? No more. Can I walk for 2 hours? Because I don't like sitting for 2 hours. No, ma'am, because this is glucose test, and glucose is the main source of energy. That will be, there is glycolysis during exercise. Always remember that exercise is a physical form of glycolysis. Kaya ano sabi ni doctor kay patient? Mag-exercise ka para medyo bumaba ang iyong blood glucose because exercise is the physical form of glycolysis. Question. Ilang beses kinuha na ng blood? Once. Take note, once. When? 2 hours after eating. What is the purpose of this test? It evaluates hyperglycemia and hypoglycemia. If after 2 hours, take note, the concentration of blood glucose is 60 milligram per deciliter and less than 60 milligram per deciliter, that is hypoglycemia. If after 2 hours, the concentration of blood glucose is 140 or greater milligram per deciliter, 140 or greater milligram per deciliter, that is hyperglycemia. Do not forget that. One-time blood collection. Take note. Huwag kalimutan. O baka may magtanong sa akin, ma'am, bakit yung auntie ko po, meron siyang 2-hour postprandial blood sugar, pero parang 2 beses po ang sample collection. If it is twice, it means there was a fasting blood sugar sample. So, itatanong mo sa akin, ma'am, do you mean FBS sample, fasting blood sugar sample, is part of the 2-hour postprandial blood sugar test procedure? No. Remember the standard procedure for 2-hour postprandial blood sugar test, once sample collection, no fasting sample. Kapag nag-fasting si patient, pagkatapos pinakain, so ibig sabihin nun, there are 2 tests. Ano yung first? FBS. Ano yung pangalawa? 2-hour postprandial blood sugar test. Is FBS part of the standard procedure for 2-hour PPBS? No, because it is postprandial test. FBS is another request. What is GTT? Tandaan na, what are the samples for glucose measurement? RBS, FBS, 2-hour postprandial blood sugar test. Then we have the glucose tolerance test. This is a multiple blood sugar test. Ibig sabihin, hindi lang once on sample collection, multiple blood sugar test. This is important for the confirmation of diabetes mellitus. It is important for diagnosis of DM, GDM, sinabi ko yun kanina, gestational diabetes mellitus, and please add another one. The glucose tolerance test is also important in the diagnosis of impaired glucose. We have patients, so many individuals with impaired glucose. Write it, please. Also for the diagnosis of impaired glucose. What are the kinds of GTT? The most common is the oral glucose tolerance test. There are 2 procedures. You have the Johnny-Isaacson method, also known as single dose method. The Johnny-Isaacson method, also known as the single dose method. Bakit ma'am single dose? Only 75-gram glucose will be given to patient, and that should be ingested after the fasting sample, given once, ingested once. Take note of that. What is the double or the divided dose method? That is the Exton-Rose method. What do you mean by divided or double dose method? The 75 grams will be separated into 2. Hahatiin yung 75 grams mo. Take note, 75 grams will be divided into 2, so it's like 37.5 lang. Take note, grams, and dissolve in water. The first half will be given after the fasting sample. The next half will be given after the 1-hour sample. So, ang tanong, which between the OGTT procedures is commonly applied? What is the answer? The Johnny-Isaacson method, also known as the single dose method. Pasensya na po sa commercial. The single dose method or the Johnny Isaacson method is the most commonly used. The glucose load, take note, full given once ingestion. Next, so what is intravenous GTT? Oh, this is used for diabetes mellitus patients with GI disorders, with gastrointestinal disorders, those who underwent GI surgery, those with malabsorption syndrome, ay talagang ibibigay talaga sa kanila intravenous GTT. Requirement, ay kailangan fasting blood, 8 to 12-hour fasting pa rin si patient. Then, there is glucose load that depends on the KBW. What is KBW? Kilogram body weight of the patient. 7.5 gram glucose times kilogram body weight of the patient. I-multiply. Kung ano nang lumabas, yun ay bibigay sa kanyang glucose load intravenously. And nakalagay dyan, intravenous administration should be within 3 minutes. Intravenous administration should be within 3 minutes. Do not forget that. Huwag kalilimutan, should be within 3 minutes. And when is the second blood collection? After 5 minutes of IV glucose. Okay, after 5 minutes. Ma'am, fasting sample, tapos 5 minutes agad. Di ba pag OGTT, fasting 1 hour, 2nd hour, 3rd hour, optional sample. Correct. Pero pag IVGTT, fasting 5 minutes, 1 hour, 2nd hour, 3rd hour. So what is the sample that differentiates the OGTT from IVGTT? The 5-minute sample. Ma'am, what is the purpose of the 5-minute sample? To check the success of the IV glucose. Dumiretso ba yung glucose sa vein? O baka naman napunta sa tissues? Ay, so ibig sabihin, ma'am, the 5-minute sample will confirm the increase in blood glucose concentration. Ay, dapat talaga increase. Ay, paano naman kung non-DM patient, dapat increase pa rin yung 5-minute sample? Ay, dapat. Why? Because that is just after 5 minutes and that is 0.5 gram glucose times kilogram body weight of the patient. Ang dami no. So the 5-minute sample is just collected to determine the success of intravenous administration of glucose and not utilized for interpretation of the results. So what are the requirements for OGTT? Syempre yan ang most common. Nako, number 1 requirement. Patient should be ambulatory. Ano ibig sabihin nito? Guys, number 1 requirement. So ano ibig sabihin? If the patient is non-ambulatory, we should not proceed with the OGTT. Hindi pwedeng ituloy ang OGTT kapag si patient non-ambulatory. Ma'am, what do you mean by ambulatory? It means the patient can walk alone, jump alone, climb the stairs, walking, jumping, dancing, move individual. That is ambulatory. So, ibig po sabihin, ma'am, hindi ko sinabi ng outpatient. Ang sinabi ko, ambulatory individual. Ibig sabihin, ay pwede rin to sa inpatient, provided the inpatient is what? Ambulatory, not bedridden. Ganun pala yun, ma'am. And nakalagay dito, inactivity or bed rest impairs glucose. So, ibig sabihin, ma'am, hindi siya pwede sa mga persons that are disabled, yung naka-wheelchair. If the wheelchair is temporary because there was an accident, hindi siya pwedeng mag-OGTT while on wheelchair. Jump, run, swim, dance alone, pwede rin siya magpa-OGTT because this is only requested for ambulatory patient. Children, that is the most important requirement. Kaya pag tinanong ka sa exam, what is the most important requirement for OGTT? A, fasting? No. Second, ambulant? Correct. Moving? Correct. Walking, jumping, running? Correct. That is the most important, not fasting. Unrestricted diet is the second, not even fasting. Unrestricted diet of 160 grams per day for 3 days prior to testing. So, is OGTT overnight preparation? Regular diet. Naku, si patient halos hindi kumakain. Ay, hindi pwede. Kailangan regular diet. 150 grams, 2 cups of rice every meal, walang problema. For 3 days. Dapat regular diet. It means regular diet. Unrestricted. Pabayaan mo siya. Kung 2 cups of rice ang kakainin niya every meal, no problem. Kasi 150 grams per day naman for 3 days. Unlimited physical activity, no problem. As long as at least 8 hours before sample collection, no exercise. Avoid smoking. Naku, kasasabi ko lang ang sa'yo kaninang morning, opening salvo natin, ang effect niyan. Alcohol is false decrease of glucose. Smoking, false increase of glucose. Saka palang may fasting. Mom, bakit 14 hours? Yan ha. Naku, kasusunod. Well, we cannot do anything about it. It is in the John Bernard Henry book. Ano ang nakalagay? That the fasting requirement for OGTT is up to 14 hours. Ibinalik na naman sa 14 hours. Take note. Oops, ma'am, bakit may fasting po sa OGTT? Because of the fasting blood sugar sample. So itatanungin mo ko, sasagutin ko na rin. Ma'am, pag FBS lang ang request, FBS lang without OGTT. Just FBS up to 12 hours. If the FBS, ma'am, is part of the OGTT, up to the 14th hour. Basahin mo po maigi ang question. The request is only FBS. What is the fasting hour? 8, maximum of 12. In the diagnosis of DM, there is a fasting sample because that is the first sample in OGTT. What is the maximum fasting requirement? That is part of the OGTT. Then that is 14 hours. Glucose load, well, 75 grams is a standard load given to males and females. Take note, for females, are they pregnant or non-pregnant? Male and females, adult. Females, non-pregnant and pregnant, 75 grams is standard glucose load. Ano ang 100 grams? Oh, para kanino lang ang 100 grams, guys? What type of patient should only receive 100 grams glucose load? Naku, may sinabi ka ako sa iyo kanina. Pregnant woman, excellent, Maria, Julia, Talia, Haka. Only pregnant woman, suspected GDM. Take note of that. Only pregnant woman, suspected GDM. And how do you define 100 grams glucose? Anong tawag mo sa 100 grams glucose load? May sinabi ako sa inyo kanina, guys. What is the description of 100 grams glucose load? 5 seconds. Follow-up load. Excellent. Christine, Kylie, Brinas. That is the follow-up glucose load. Excellent. So therefore, if it is a follow-up glucose load, is it in the one-step method, OGTT, or is it in the two-step method, OGTT? Kasi kailangan very specific tayo, guys. Naku, ang dami ng sumagot. Nauna si Miss Naomi Pompa. That is now the two-step method. Tandaan mo, guys. That is follow-up load. Mom, what is the glucose load for standard OGTT? 75 grams because the standard OGTT is one step. That's why that is the most commonly used. However, for children, ay hindi po 75, hindi po 100 grams, hindi din 50 grams. 50 grams is the glucose, yun tatawag na glucose loading priming dose or initial dose sa two-step method. Hindi yan ang ginagamit mo sa children. What is the glucose load for patients under the category of children or child, ibig sabihin until the 18-year-old, 1.75 grams glucose times kilogram body weight of the patient. 1.75 grams glucose times kilogram body weight of the patient. And according to WHO, the maximum glucose load that should be given, guys, to a child is up to 75 grams only. Mom, parang kapag si patient child medyo obese, 1.75 tapos tinimes namin sa kilogram body weight, umabot po ng 76 grams. of 76 grams. Nako, hindi mo bibigay 76 grams glucose load. Up to 75 only. Ma'am, paano nung kinumpute namin 1.75 grams times kilogram body weight? Obese po kasi si child, umabot ng 80 grams glucose load. Nako, may sinabi na naman ng WHO, only up to 75 grams. Nagkakaintindihan tayo dyan, children. What is the procedure for OGTT? The first sample is known as the 0-hour sample. My goodness gracious, great balls of fire. What is the 0-hour sample in the whole clinical chemistry? That is the FBS sample in OGTT. Ma'am, paano pag tinanong kami sa board exam, how do you call the fasting blood sugar sample? FBS. Ma'am, sabi mo po 0-hour sample. You will only say that FBS is the 0-hour sample if that FBS sample is part of the OGTT. If that is a standalone FBS sample request, FBS test request is standalone, not part of the OGTT, FBS sample yon. But if the FBS sample because OGTT is a timed test. Then you let the patient drink the glucose load within 5 minutes. Ma'am, lumagpas ng 5 minutes. Naku, depende sa institution if you want to accept the sample. Because according to standard, the question in the board is standard, we should only accept that first-hour sample if the glucose load was taken within 5 minutes. Mom, it was taken within 5 minutes. However, while taking the glucose load, 75 grams, nag-vomit si patient. Oh my gosh. While taking the glucose load, 50 grams, nag-vomit na naman si patient. Oh my God. Or the 100 grams, nag-vomit si patient. Discontinue the test. Kasi kailangan kompleto niyang maubos yun. Ganun pala yun, ma'am. Yes. Then, after that, collect the first hour, the second hour, the third hour sample respectively. Guys, the third hour sample is what? Optional sample. With or without third hour, doctors can actually make their diagnosis. So what are the routine samples? FBS, 1 hour, second hour sample. Write it, please. FBS, 1 hour, second hour, or 0 hour, 1 hour, second hour OGTT samples. The third hour sample is optional. Next, since tatlo yan, 0 hour, 1 hour, second hour sample, which of the three samples are so important for the diagnosis of the patient? The 0 hour sample or FBS and the second hour sample. Those are important for diagnosis. The 0 hour and the second hour sample. Huwag kalimutan, WHO defines young people 10 to 24 years old. Take a photo please para magka-idea ka lang. Baka gamitan ka ng word na adolescence. Ano ba yung adolescence, ma'am? 10 to 29 years according to WHO. Youth, ako baka ilagay sa board exam. This 16-year-old youth, 16-year-old na youth pa, ma'am, ano ba talaga? Youth talaga yon, 15 to 24 years. Kung sabi, this female youth, baka sakali lang, hindi natin masabi children, ma'am, bakit WHO? Yan kasi ang sinusunod na definition, yung galing sa kanya. 15 to 24-year age group. Young people, 10 to 24. Adolescent, 10 to 19. Youth, 15 to 24. Take note. That is according to WHO. What else? And let's go to interpretation. For the interpretation of results, well, there are 3 categories. Sabi sa'yo ng doctor, congratulations, non-DM ka. Naku, happy tayo nun. Bakit non-DM? Kasi FBS mo, 70 to less than 100. How less? 99. 70 to 99. Ma'am, bakit sa'yo nakalagay 70 to less than 100? Hindi na lang 99. Yung nasa reference book. Hindi natin kasi pwedeng palitan yung children. That's why teachers will explain it. How less is the less than 100? 70 to 99. Take note. And what is the second hour sample? That is the confirmatory sample. What is the 0 hour sample or FBS? That is the screening sample. If the second hour OGTT sample is less than 140 milligram per deciliter, that is confirmed non-DM. Mga paano pagkabata, Remember anong FBS ng mga kids, ha? Ito accepted na FBS sa mga kids. 60 to 100. Ma'am, si adult less than 100, 99 siya. 60 to 100 talaga. That is according to reference book. 60 to 100. How about DM? Naku, sinabi ko na sa iyo kanina pa ulit-ulit. 126 or greater, DM. Especially in more than one occasion. Last week, 126. This week, 127. Ano sabi ni doctor? Talagang meron kang DM. Take note. Oops, tandaan mo children, OGTT should not be used if the FBS of the patient is already 126. If the fasting blood sample already reached the diabetic level, what is the instruction of WHO? Do not use or do not give 75 grams glucose or 100 grams. Huwag na kasi that is already considered increased. Pero kung sakali lang for research purposes, nag-perform ng OGTT sa diabetes mellitus patient, but that is dangerous because 126 na yung FBS, huwag mo na painumin ng 75 grams or 100 grams kasi 126 na. Dapat hanggang doon na lang. But for research purposes, take note. If the second hour OGTT reached 200, confirm DM because FBS is the screening test. 200 and greater, confirm DM. Next, ma'am, paano pag yung FBS 100 to 125? Is it DM? No. Is it non-DM? Hindi rin kasi non-DM, 99. So it is between the normal and the non-DM. How do we interpret FBS of 100 to 125? Write it please. Impaired fasting glucose. What do you mean by impaired fasting glucose? Not DM, not non-DM. Diba? Double negative yun, not non-DM. Ibig sabihin, hindi DM, hindi rin naman normal. It is impaired fasting glucose. So next question, what is the confirmatory test for impaired fasting glucose? Ano ba to DM? Hindi. Ano ba to non-DM? Hindi. O i-confirm na nga natin, the OGTT. And what is the confirmatory sample? The second hour. Because if the second hour is 140 to 199, confirm impaired fasting glucose tolerance. Ma'am, ano ibig sabihin ng impaired fasting, impaired glucose tolerance? Potential diabetes mellitus individual. Potential diabetes mellitus individual. Pag less than 140 ang second hour OGTT, non-DM. 200 and greater DM. What if it is in between 140 to 199? Potential DM. Not yet, but going there. So, ang tanong, is it true that OGTT is confirmatory test and used for the diagnosis of impaired glucose? Sinabi ko yan kanina, guys. DM is a diagnostic test for DM, GDM, and impaired glucose. Take note, huwag kalilimutan. Then, interpretation, therefore, 2 hours after a glucose load, blood glucose should return near fasting level. Yun ang rule talaga. 2 hours after a glucose load. Symptoms of DM such as polyuria, polyphagia are observable if the plasma concentrations reach 200 and above. Kaya di ba sabi ng patient, Doc, hindi po ako naniniwala sa sinabi niyo sa akin na meron po akong diabetes mellitus. Why? Kasi Doc, wala naman po ako, ito nabasa ko sa Google search, pag meron ka daw pong DM, meron kang polyuria, excessive urination, wala po ako nun. Pag meron ka daw pong diabetes mellitus, meron kang excessive eating, wala rin po rin ako nun. And there should be polydipsia, excessive thirst, wala rin ako nun, Doc. So I think that result from the laboratory is fraudulent, false, and incorrect. Ano sabi ni doctor sa patient? Patient, let us all remember that the 3 P's of DM, polyuria, polyphagia, polydipsia, will only come out if the FBS or RBS reach 200 and greater. If it is just 126, 130, 40, 50, 60, 70, 80, 90, wala. But if it is 200 or more than, then you have the 3 P's. Sabi ng patient, kaya pala ako walang nararamdaman. Tama. Next, nako, tinanong ka sa exam. Last question. The FBS of the patient was 89 milligram per deciliter. FBS, how do we define that? Normoglycemia. Mom, what is hyperglycemia? FBS of 126 and above, that is hyperglycemia. FBS of 60 and lower, that is hypoglycemia. But if the FBS is between 70 to 99, that is normoglycemia. Bakit ba may glucosuria? Maiisip mo na naman, Mom, sabi mo kanina ang glucosuria if the blood glucose, fasting or non-fasting, take note the blood glucose, fasting or non-fasting, exceeds 180. 181 and above na po yung RBS or FBS niya. Umabot ng 181 and above. Saka lang may glucosuria. Baka dito, Ma'am, 89 lang FBS tapos may +1 sa urine? Question, is it DM? Is it non-DM? Or is it impaired glucose? Kung board exam ba yung tinanong ka ng last question na ito, last slide. This is question 100 in the licensure exam. Example, what is your answer? FBS of 89 but +1 glucose in urine. Is it non-DM? Is it DM? Is it impaired glucose or is it incorrect result? Meron daw mali sa result. Baka yung urinalysis o kaya yung FBS ang mali, sabi sa question. Children, if today is licensure exam, this very hour, what is your answer? DM, non-DM, impaired? What is the answer? Non-DM. Non-DM but with renal tubular dysfunction. Take note, non-DM but with renal tubular dysfunction. It means damage to proximal convoluted tubule. Remember that the PCT, the proximal convoluted tubule, that is the renal tubule responsible for the complete reabsorption of glucose. Pag sira ang PCT, wala tayong magagawa. There is glucosuria in the presence of normoglycemia. That ends our lecture. I hope you learned something new. That ends our lecture, guys. I hope you learned something new. Normoglycemia with glucose